In this video, I'll talk about blepharitis. So blepharitis is a common chronic inflammation of the lid margins, and it causes red, irritating, itchy, dandruff-like scales and crust on the eyelashes, where you can see in the second picture over here. And in the first picture, there is eyelid swelling, especially the upper eyelid, and also erythema. So this is an anatomy of the eyelid, and there are two types of blepharitis, the anterior and posterior blepharitis. So anterior blepharitis refers to the inflammation mainly centered around the skin, the eyelashes, and the lash follicles. You can see over here the hair follicles. So that one is for anterior blepharitis. Whereas for the posterior blepharitis, it involves the meibomian gland and orifices, the tarsal plate, and the blepharoconjunctival junction. So there are two types of blepharitis, anterior and posterior blepharitis. And for anterior blepharitis, it is usually subdivided further into the staphylococcal and seborrheic blepharitis. Staphylococcal blepharitis is primarily due to the infection of the lid margins by Staphylococcus bacteria, for example, Staph aureus or epidermidis. And in this staphylococcal blepharitis, the lid margin is inflamed and coated with scales. The eyelashes are stuck together by the crust. Whereas for seborrheic blepharitis, it can occur in association with seborrheic dermatitis. And this abnormality is due to an overproduction of sebum by the glands at the lid margin, especially the meibomian glands. And then the bacteria will metabolize the sebum, producing irritant-free fatty acids. Whereas for posterior blepharitis, it affects the inner edge of the eyelid, and it is due to the dysfunction of meibomian glands. So in posterior blepharitis, the openings of the meibomian glands become plugged, blocked, and causing dry eye, which can result in inflammation and infection of the eyelid. For clinical features, in anterior blepharitis, the patient might present with tired, itchy, sore eyes, which are worse in the morning. There will be crusting of the lid margins, or you can see in this picture here. Redness and scaling of lid margins, especially seen in staphylococcal cause. Debris around the eyelashes, and also sometimes there may be reduced eyelashes. Whereas for posterior blepharitis, it is due to the obstruction and plugging of the meibomian orifices. So this picture over here shows some of the plug orifices. And other presentation include injection of the lid margin, which means redness, and also conjunctiva, and tear film abnormalities and punctate keratitis. So let's take a look at treatment. For anterior blepharitis, can do lid toilet with cotton bud wetted with bicarbonate solution or diluted baby shampoo to remove the squamous debris. You can give topical steroids to reduce the inflammation, but this is rarely used because to avoid steroid complications. Other treatment include fusidic acid gel, especially for staphylococcal eyelid disease. It is a topical antibiotic. For posterior blepharitis, can do lid massage after hot bathing through the closed lids. So this is to express the abnormal secretions in the meibomian glands. If this treatment fails, then we can try to give topical azithromycin drops. Alternatively, meibomian gland function can be improved by short courses of an oral tetracycline or doxycycline. So when the obstruction of the meibomian gland is very extensive, the absence of the oily layer on the tear film can induce an evaporative dry eye. So this will require treatment with these artificial teardrops. That's all for my video. Thank you.